Understanding Medical Documentation, brought to you by Oakland Community Health Network. Understanding Medical Documentation is part of the Oakland Community Integrated Healthcare Collaboration Project, which allows for individual organizations to determine the level of training needs of their staff based on position and job responsibilities, upward movement in terms of skill competency for staff, and coordinated primary care needs of people with severe mental illness or intellectual and developmental disabilities. Learning objectives are to understand basic lab tests ordered prior to psychotropic medication interventions, and to discuss common physical illnesses, diagnosis, and treatment, and to discuss common medical tests. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The World Health Organization states there is no health without mental health. Through combining mental and physical health, we want to look at individuals holistically. And due to psychotropic medication interventions, individuals may be at higher risk. Nowhere is the relationship between mental and physical health more evident than in the area of chronic conditions. The associations between mental and physical health are the facts that people with serious mental health conditions are at a higher risk of experiencing chronic physical conditions, and people with chronic physical conditions are at a higher risk of developing poor mental health. Understanding the links between the mind and the body is a first step in developing strategies to reduce the incidence of coexisting conditions and to support those already living with mental illness and chronic physical conditions. Key aspects in prevention include increasing physical activity, access to nutritious foods, ensuring adequate income, and fostering social inclusion and social support. Did you know 67% of individuals who have heart disease also suffer from depression? And 58% of individuals who have cancer also suffer from depression. Schizophrenia is associated with double the risk of death from heart disease, and schizophrenia is associated with 3 times the risk of death from respiratory disease. Psychotropic medication tips. Here's a list of the most frequently prescribed psychotropic medications in millions of prescriptions per year. The most frequently prescribed is Xanax, then Zoloft, Celexa, Prozac, Ativan, Clozaril, and Lexapro. Things a woman should know before taking prescribed psychotropic medications. All females of childbearing age should have a pregnancy test before beginning treatment of mental illness with medication. Psychotropic medication therapy is prescribed by physicians cautiously within pregnancy. The goal is to have a reduction in symptoms without harm to the fetus. It is best to tell the doctor about all medications and vitamin supplements currently being taken, prescribed and over the counter, and to remind the doctor about any allergies or any problems with medications. And this goes for all doctors being seen, specialists, primary care, or even dentists. It is best to understand how to take the medication before starting it and to take the medication as instructed. Don't take medications prescribed for another person. They are only meant for the person prescribed to be taking them. Call the doctor right away if there are problems with medicine, such as severe side effects or allergic reactions. Prior to a person starting psychotropic medications, some tests may be requested by the prescribing doctor to complete. These would include a CBC, known as a complete blood count, with differential, and this just measures the actual red blood cells and white blood cells, can determine if the person's anemic or has an infection. A hemoglobin A1C may be ordered, and this is the average blood glucose of the person for the past 3 months, and a fasting lipid panel, and this looks at cholesterol levels and kidney functioning tests, which include creatinine, urea nitrogen, also known as BUN. Some other tests included would be comprehensive metabolic panel, which includes liver functioning test, ALT, ALP, AST, and albumin. It'll test for electrolytes, sodium, potassium, and calcium, and that's their abbreviations, Na, K, and Ca. It'll check for glucose. And the risk of diabetes, if a random blood glucose is taken, and that's higher than 200 milligrams per deciliter, and random means regardless of whether a person recently had food. And if an 8-hour fasting blood sugar is checked and the measurement is greater than 126 milligrams per deciliter, there's a chance that the person could be diabetic, but the more tests would be taken. And then also a urinalysis may be completed. Types of blood test. The next several slides will explain the differences in the blood test. A complete blood count, known as a CBC, is a blood test to measure overall health and detects infection. White blood cells fight infection. Red blood cells contain hemoglobin, which carries oxygen to our body's tissues. And there's also platelets, which are a kind of a blood cell fragments that stop bleeding. The comprehensive metabolic panel provides the current status of a person's metabolism, including the health of the kidneys and liver, electrolyte and acid-base balance, as well as levels of blood glucose, also known as blood sugar. Within a CBC, which is a complete blood count, white blood cells are counted, and white blood cells protect the body against infection. A white blood cell differential includes 5 different types of cells. White blood cells are an important part of the human immune system because they fight infections by attacking bacteria, viruses, and germs that invade the body. They originate from the bone marrow and circulate throughout the bloodstream. A white blood cell differential totals the number of different types of white blood cells, and there's 5 different types: neutrophils, eosinophil, basophil, monocyte, and lymphocytes. A white blood cell differential may be used to help diagnose conditions such as infections, inflammation, allergies, leukemia, or blood disorders. An absolute neutrophil count counts the number of white blood cells that are neutrophils, and this can help diagnose a special condition or screen for a condition. A hemoglobin A1C provides an overall view of the last 3 months' average of a person's blood glucose level. It could be an indicator of diabetes or hypoglycemia, which is low blood sugar, and it can provide information on diet compliance or non-compliance, depending on the number that's the result. Electrolytes are present in the human body, and the balance of the electrolytes in our bodies is essential for normal function of our cells and organs. Common electrolytes that are measured through blood testing are sodium, abbreviated Na, potassium, abbreviated K, and calcium, abbreviated Ca. Sodium regulates the total amount of water in the body. It plays a role in critical body functions. A normal sodium level is 135 to 145 milliequivalents per liter. An increase of the sodium level in a body is called hypernatremia, and this may be related to kidney disease or too little water intake and loss of water due to diarrhea and or vomiting. Decreased concentration of sodium is called hyponatremia, and some of the causes could be liver or kidney disease, congestive heart failure, and severe burns. A normal potassium level should be between 3.5 to 5 milliequivalents per liter. Hyperkalemia is a potassium level higher than 5 milliequivalents per liter, and this is commonly related to chronic kidney disease or acute kidney failure. Hypokalemia is a potassium level below 2.5 milliequivalents per liter, and this is related commonly to prescription medications that cause an increased urine output, such as diuretic types medication used for high blood pressure and heart diseases. Here is an example of some foods high in potassium: avocados, banana, potatoes, spinach, beans, citrus juices, and fish. A normal calcium level is 8.5 to 10.2 milligrams per deciliter. Hypercalcemia is when the calcium levels in the blood is above normal, and hypocalcemia is when the calcium level in the blood is below normal. The kidneys are two bean-shaped organs, each about the size of our fist. They are located below the rib cage, one on each side of the spine. Every day they filter 120 to 150 quarts of blood to produce 1 to 2 quarts of urine, which is composed of waste and extra fluids. Sometimes a person can develop a kidney stone in the ureter, which connects, it's a tube that connects the kidneys to the bladder. The kidney stone gets stuck in the ureter, causing urine to back up to the kidneys, and this causes intense flank pain, which is on the back and on the side in your back, and it can also cause nausea and vomiting. A doctor may place a stent in the ureter, and also lithotripsy may be used to break up the kidney stones. Kidney functioning tests include the blood creatinine levels, and these determine how well the kidneys are working. Creatinine clearance level, this measures how well creatinine is removed from the blood by the kidneys. And BUN, also known as blood urea nitrogen test, and this measures the amount of urea in the blood. The liver is a very important organ, and it is located in the right upper quadrant of the abdominal cavity. It weighs about 3 pounds. Its function is to filter blood coming from the digestive tract before it passes into the rest of the body. It also detoxifies chemicals and metabolizes drugs. The liver is also important for making proteins for blood clotting and other functions. Liver functioning test. AST, this is an enzyme produced by the liver. AST is normally found in the liver, heart, muscle tissue, pancreas, and kidneys. The levels are increased in the blood if the liver is damaged. ALT, this is an enzyme that is normally contained within liver cells, and they break food down into energy. If the liver is injured, the liver cells spill the enzymes into the blood, raising the enzyme levels in the blood and signaling liver damage. The liver can be damaged by trauma, such as a car accident, which causes bruising or even a laceration, or a disease process such as cirrhosis or pancreatitis. The liver could also be damaged by using drugs, even prescription medications, and alcohol. Tylenol is also toxic to the liver, and the manufacturer recommends no more than 3,000 milligrams per day at this time. ALP, alkaline phosphate, this is an enzyme in the liver, bile ducts, and bone. There will be high levels if there is liver damage or disease, a blocked bile duct, or bone disease. Albumin, this is a protein made by the liver that makes up about 60% of the total protein in the blood and plays many roles in the body. Psychotropic medications and blood work. Carbamazepine, that's a generic name for Tegretol, Carbitrol, Ecotrol, and Epitol. It is an anticonvulsant and a mood stabilizer. It is chemically related to a tricyclic antidepressant. It's used to treat seizures, nerve pain, and bipolar disorder. And these are some of the medications that require frequent blood draws to check their levels and if there's any toxic levels or even to make sure a person's in the right blood level for the therapeutic range. Here's an example on Tegretol as far as blood draws. Tegretol is prescribed for mood disorders and also seizure disorders. A serum Tegretol level is usually drawn as a lab draw 1 month after initiation, then monthly until a therapeutic range is achieved, and then every 3 months when a person has achieved that therapeutic range, and then every 6 months while the results are within the therapeutic levels. It's best to avoid grapefruit and grapefruit products when someone is taking this medication, and a physician may also order a white blood cell count to make sure a person's not developing an infection and everything's normal. Here's a list of tricyclic antidepressants. On the left is the brand name, and on the right is their generic name. When someone was prescribed a tricyclic antidepressant, blood work may have been ordered by the doctor to determine the most effective dose or to measure the amount of tricyclic in their system if that was needed to be known. Tricyclic antidepressants were the first generation antidepressants and are usually only prescribed today when a newer generation is not helping. Tricyclic antidepressants have many side effects and there is a risk of overdose. Some of the newer generation types today that are used are Prozac, Cymbalta, Effexor, and Wellbutrin, and there are many more. The newer generations have much less side effects and they do not require any blood work. Clozapine, also known as Clozaril, which is a brand name. This is an atypical antipsychotic medication mainly used for schizophrenia that does not improve following the use of other antipsychotics. This medication may reduce the rate of suicidal behaviors. It is found to be more effective than typical antipsychotics. It is also effective for those who are treatment resistant, and this is a medication that is taken by mouth. Clozaril is associated with a high risk of low white blood cells. Therefore, lab work must be completed on a regular basis to check the person's blood work for a low white blood cell count. When this medication is started, there will be weekly blood work required for the first 6 months, and then for the next 6 to 12 months, every 2 weeks there will be blood work required as long as there's no problems, and then after 12 months, blood work's required every 4 weeks. The pharmacy will require a copy of the blood work before the medication is dispensed, and then once it's discontinued, the person will have blood work at 4 and 8 weeks when it's discontinued to make sure that their white blood cell count is where it needs to be and they're healthy. What do I need to know about Depakote? When someone has been prescribed Depakote, the doctor will order a serum Depakote level to be drawn, and this is simply a blood test. It will be ordered about 1 month after initiation of therapy, then monthly until a therapeutic level has been reached, then every 6 months after the therapeutic range has been obtained. Liver functioning tests will also be ordered, and the person should be observed for any jaundice, which is yellowing of the skin and eyes, and be assessed for abdominal pain ongoing, just to make sure everything's working out with the medication. And the Depakote dosage is influenced by their weight, and they usually come in large capsules, but it also is available as a liquid and an injectable as well as a gel. This is a well-tolerated medication overall. When a person is prescribed lithium, this is also called Escalith, is another name for a medication that is the same as lithium. They will have an ordered blood test periodically, and there is a therapeutic range of 0.8 to 1.2 milliequivalents per liter. And this is usually ordered by the physician 1 month after initiation of therapy, then monthly until a therapeutic level is obtained. Then it should usually be ordered about every 3 months while they're within the therapeutic range. Signs of toxicity when someone's on lithium include blurred vision, ringing of the ears, lack of coordination, muscle weakness, tremors, diarrhea, nausea, or vomiting. But usually it's a very well tolerated medication, but it does need to be monitored that someone is in their therapeutic range. When someone is prescribed lithium and they start vomiting or they have diarrhea, it's best for them to hold the lithium, meaning not to take it, and to obtain a lithium level. And this would be an order by their physician. So inform them to call their doctor if they're having any signs of lithium toxicity and find out what the doctor would like them to proceed with. Signs of lithium toxicity are diarrhea and vomiting, muscular weakness, dizziness, mental status changes. Next, we'll be reviewing the thyroid gland, which is located in the neck area. The thyroid is a butterfly-shaped gland that lies in front of the windpipe, just below the voice box area. The thyroid gland uses iodine from food to make two thyroid hormones, T4 and T3, and the thyroid gland stores these hormones and releases them as they are needed. These hormones can affect energy levels, mood, and even weight. They can also be factors in depression. An overactive thyroid is known as hyperthyroidism. A person may have Graves' disease if they have an enlarged thyroid, have hyperthyroidism, and they may experience weight loss and intolerance to heat. An underactive thyroid is known as hypothyroidism. This is a low levels of thyroid hormones, and a person may be prescribed a medication called Synthroid. And also, if someone is prescribed lithium, this can affect the thyroid also, and a side effect is hypothyroidism. AIMS, also known as Abnormal Involuntary Movement Scale. This is a rating scale developed in the 1970s to measure involuntary muscle movements known as tardive dyskinesia that may occur as a side effect to antipsychotic medication. An AIMS assessment should be completed every 3 months by the prescribing doctor. A trained nurse can also complete this assessment. A person that is taking an antipsychotic would be observed for signs of tardive dystonia, which are involuntary painful muscle spasms of the arms and legs and torso, and it causes abnormal movements and postures, and tardive dyskinesia, which are involuntary movements that are more rapid of the face, tongue, lips, and such as eye blinking and moving their arms and legs more rapidly and jerking. A person should also be observed for signs and symptoms of Parkinson's, such as shaking and having an unsteady gait. An AIMS assessment can be requested at any time, and a couple medications that are known to be related to tardive dystonia and dyskinesia are Haldol and Prolixin. A person that may have these symptoms should have their medication changed, or they might try a lower dose to see if the symptoms are relieved or not as prominent. Keep calm and do the test. The next several slides will discuss some common medical tests. Electrocardiogram, also known as EKG or ECG, this checks the heart for problems with the electrical activity, and it translates the heart's electrical activity into line tracings on paper. The spikes and dips in the line tracings are called waves. The test checks for the health of the heart and the presence of other diseases such as high blood pressure, high cholesterol, cigarette smoking, diabetes, and family history of early heart disease. An EKG is often done prior to psychotropic medication therapy and if there's an increase in the medication needed. An electrocardiogram can give information on the condition of the heart, and it can be a reason for more testing. This is a picture of how the electrocardiogram translates the heart's electrical activity into line tracings on paper. In the upper right corner there it shows the P wave on the left side, the QRS complex in the middle there, and then the ST segment and the T wave on the far right. The P wave is a record of the electrical activity through the upper heart chambers or the atria. The QRS complex is a record of the movement of electrical impulses through the lower heart chambers or the ventricles. The ST segment shows when the ventricle is contracting but no electricity is flowing. The ST segment usually appears as a straight, level line between the QRS complex and the T wave. The T wave shows when the lower heart chambers are resetting electrically and preparing for their next muscle contraction. This is a picture of the heart and its electrical system. The heart has 4 chambers. The 2 upper chambers are called the atrias. There's the right atria and the left atrium. The 2 lower chambers are called ventricles. There's the right ventricle and the left ventricle. A sleep study may be needed for someone that is having problems during their sleep. Some people have problems staying awake during the day, and this is called narcolepsy. There are also problems with nighttime behavior such as sleepwalking, night terrors, or bedwetting. Sleep apnea occurs when an adult regularly stops breathing during the night for 10 seconds or more. They may need a CPAP machine. This would be ordered by a physician after a sleep study is completed. CPAP is short for continuous positive airway pressure. This machine kind of blows air into the person's mouth and it keeps the throat muscles from collapsing. A person would feel more refreshed, like they had a better night's sleep when they use a CPAP machine. CPAP machines need to be cleaned on a regular basis, and this can be done by running water through the hose using a mild dish soap or maybe using vinegar and water, depending on what's recommended by the manufacturer or the equipment dispenser. The CPAP machine sometimes takes a while for the person to get used to using the CPAP mask, and it's best for them to practice during the day while they're watching TV. Sleep studies also diagnose problems sleeping at night, including insomnia, shift work sleep disorders, periodic limb movement disorders, and problems with stages of sleep. Normally, a person has 4 to 5 cycles of REM, which is rapid eye movement, and NREM, which is non-rapid eye movement, sleep cycles. Common sleep study tests. A polysomnogram electronically transmits and records specific physical activities while a person sleeps. This test measures brain activity and eye movement, oxygen and carbon dioxide levels, heart rate and rhythm, breathing rate and rhythm, the flow of air through the mouth, nose, snoring, body muscle movements, and belly movements. The multiple sleep latency test. This measures how long it takes a person to fall asleep and their REM sleep. The maintenance of wakefulness test. This is completed in a lab during the daytime. It measures how well a person can stay awake during a period of time in a quiet, relaxing, stimulation-free environment. A lack of sleep may cause health conditions as well as psychotic symptoms. And also there are some health conditions that can cause sleep problems. If a person believes they have sleep apnea or any kind of sleep problem, it is best they speak with their doctor to discuss the importance of a sleep study and to have one completed. If someone thinks they have sleep apnea, a split night study may be needed. The first night is to determine if they have sleep apnea. The second study would be if they have sleep apnea to determine the air pressure needed for their machine. Computerized tomography, also known as a CT scan or CAT scan. This is used to define normal and abnormal structures in the body. It also assists in procedures by helping accurately guide the placement of instruments and treatments. It is an X-ray procedure that combines many X-ray images with the aid of the computer to generate cross-sectional views and three-dimensional images. It also can help diagnose traumatic injuries such as blood clots or fractures. It also helps with cysts, tumors, or infections that need to be identified. And it can also measure bone density when evaluating osteoporosis. And also, when this is completed, a contrast material can enhance the scan. But CT scans can be done with or without a contrast material, depending on what the physician needs. Magnetic resonance imaging, or MRI scan. This is a radiology technique that uses magnetism, radio waves, and a computer to produce images of body structures. The MRI scanner is a tube surrounded by a giant circular magnet. The patient is placed on a movable bed that is inserted into the magnet. An MRI can detect tiny changes of structures of the body. Contrast dye may be used. A person cannot have any metal like piercings or jewelry during this procedure. MRI scans are used for the following: brain swelling, bleeding, a brain aneurysm, strokes, tumors of the brain, and inflammation, to evaluate the integrity of the spinal cord after trauma, to diagnose problems with the spinal cord, to evaluate the structure of the heart and aorta where it can detect aneurysms or tears, and to gather information on the glands, organs, joints, and soft tissue and bones of the body. There are other reasons an MRI scan may be used, and it may help decide if surgery is necessary or an option. Positron emission tomography, also known as PET scan. A PET scan uses a special type of camera and a tracer known as a radioactive chemical to look at organs of the body. The tracer is a special form of a substance like glucose that collects in the cells that are using a lot of energy, such as cancer cells. There are two different types of PET scans: structural imaging and functional imaging. Structural imaging creates a snapshot of the brain structure, including bone, tissue, blood vessels, tumors, infection, damage, or bleeding such as from a stroke. Functional imaging reveals the brain's ever-changing activity and chemistry by measuring the rate of blood flow, chemical activity, and electrical impulses during specific tasks. Brain scans can show damage to brain tissue, the skull, and blood vessels in the brain. A brain scan can be used with other medical tests to help doctors find the right diagnosis for mood and behavioral problems. It can also help researchers study healthy brain development, effects of mental illness, or the effects of mental health treatments on the brain. A brain scan cannot diagnose mental illness when used by themselves or predict the risk of getting a mental illness. This slide shows examples of various scans. On the far left is a CT scan, and displayed is a scan of organs and bones. In the middle is the PET scan, and it's showing cell activity. On the far right is a scan that combines the PET scan and the CAT scan, and it shows the exact location of high cell activity. And this is a combined test that can actually pinpoint a more accurate diagnosis, and most scans today are this type, that are the combined test. A PET scan is used to evaluate if surgery is an option, to find poor blood flow to the heart. It can measure blood flow and glucose metabolism. A map can be produced of the brain. A PET scan is also used to detect and evaluate cancer stages. And radiation is used during this procedure, and it is used by using a radioactive tracer that is placed in an IV line. This is considered nuclear medicine. There is a possibility of having a side effect to the radiation. There is minimal exposure to the radiation, but there's also a risk of having an allergic reaction, but the risk is small. PET scans can detect brain activity in mental illness. Major depression has hypofunction of the left frontal lobe. Bipolar disorder has hyperactivity in both temporal lobes. OCD has hyperactivity in the occipital and frontal lobes and overstimulation of the basal ganglia. The basal ganglia is located in the midbrain section. Schizophrenia has hypofunction in the frontal lobe. This is a picture of a brain during a PET scan. All medical tests must be ordered by a person's doctor. Here are some discussion questions. What are barriers individuals may face accessing health care? Some of them can be poverty, isolation, needing employment, and usually needing full-time employment to get health insurance. And how can we overcome these barriers? How can we incorporate better coordination of care? How can we educate one another? My Strength is the health club for your mind. This is an online tool that you can use on your phone or on the computer that has self-help resources to empower you to be mentally and physically healthy. It's at www.mystrength.com. Resources used for this PowerPoint and for anyone to refer to learn more information include webmd.com, labtestsonline.org, and mayoclinic.org. This concludes the presentation on understanding medical documentation. If you have any questions or concerns, please feel free to contact Susan or Nicole at the following email addresses or phone numbers. Thank you for watching.